So, joining me now is Laila Jassmi, the founder of Health Beyond Borders, a Dubai-based health consultation firm. Mrs. Jassmi, can you tell me a bit about how COVID has affected your work?
Well, actually, COVID has a lot of impact, and especially from the healthcare perspective. And since I'm a consultancy based company, so most of my clients are healthcare providers or equity firms that look into investments into the UAE. So it has been impacted a lot when it comes to more of doing the studies or investing and all of that. However, I found another venture for my company is that to work with my existing clients or a new client on finding new ways in order to improve their services or to deal with this pandemic, since it is something new that we have never ever experienced before.
And what would you say, what are the biggest learnings that you've taken? You said you found new ways. What would you say, what's the biggest takeaway that you've had?
The biggest takeaway that I found is that it was the time for our healthcare providers to find and to invest into more into digitalization of the healthcare and telemedicine. Yet we had this being implemented, but it was not being taken further into implementation. And when it comes to educating the community and the public toward using this kind of a platform was totally new. So I had to work with my clients, either they are existing clients or new clients, to find this way and try to implement this kind of strategies into the community.
So, looking at the future, what would you say is the biggest challenge that we face in the next few months, and how can you help overcome it with Health Beyond Borders?
I think what we need to do is that looks more into investing into smart hospitals, smart healthcare systems, into our existing hospitals or healthcare work network. And we need also to look at the rural areas, especially in the Gulf countries. We have a lot of rural area that been deprived from high tech. So we need to extend the service to rural area, and we need to invest a lot into the education awareness of our public toward using more of an electronic platform. And also we need to encourage our patients to do more of a telehealth consultation with the physician, because basically the people there are more into face-to-face contacts and discussing with the doctors. But the pandemic had teach them something is that they still can network with their physician while they are back at home. So we need to invest a lot into that. The new generation are more tech oriented, the old generation is not. And this is something that is being invested a lot now.
Okay, thank you very much for those insights. That was Laila Jassmi from Health Beyond Borders. Thank you.